Management of cardiogenic shock. Management of cardiogenic shock. So first of all, let's just have an overview of what a cardiogenic shock is. First of all, cardio means heart. So cardiogenic shock, it could be that there's any disease condition of the heart that is now making the heart not function properly, right? So it could be that there's aneurysm of the left ventricle. That means what, the left ventricle is now being enlarged. So if the left ventricle is now being enlarged, its strength will not be maintained. It will not be pumping as hard as it should, right? So there's aneurysm of left ventricle, then there's myocardial infarction. All right, like it could be myocardial infarction, right? Due to myocardial infarction. Myocardial infarction is like there's a blood vessel, and by the side of the blood vessel, there's now deposition of fat. So that it is now what, narrowing the pathway for the blood vessel, right? It could be due to that myocardial infarction. The thing is, if there's a cardiogenic shock, if there's a venous congestion, like there's congestion of blood in the veins, okay, it will show that there's what, distended neck veins. Okay, show that there's a distended neck vein. Then there will also be raised CVP. That's what, the central venous pressure will be raised. Okay. Then one thing is you might want to rehydrate the person. Okay. So diuresis with what, furosemide, and you give it IV. That's what, intravenous, about 10 to 40 milligrams over 2 to 5 minutes. So you rehydrate the patient and all that. Then if there's severe hypotension, you evaluate for this word, myocardial infarction with ECG. You know, hypertension, like the blood pressures are kind of like going too down. So you might be suspecting that, okay, no, there might be a blockage of any vessel of the heart. Okay, so if there's a blockage of any vessel of the heart now, you just evaluate it with what, ECG, so that you can know. All right. Then if there's any underlying cause for the cardiogenic shock, even apart from the myocardial infarction, just like I told you guys, it could be aneurysm of the left ventricle. It could be that there's what, enlargement of the right ventricle. It could be that there's enlargement of the two ventricles. There are so many causes. It could be that there's coarctation of the aorta, that the aorta is being blocked and all that. Okay, so you evaluate all these things and you treat it. Okay, so when you treat them, basically there's an underlying something causing a problem. If you take down the underlying something, the problem will go away. Okay, those are the basics for management of cardiogenic shock.